All right, I'm back. We're going to quickly talk about strokes. Stroke, very simply, is a lack of blood flow to a portion of the brain. Now, you have arteries all around your brain called cerebral arteries, and if there's a problem with one of those arteries, either it's plugged or it's burst, either way, there's no blood flow getting to that part of your brain that needs it. Now, what's unique about your brain is that it controls a lot of different things in your body, right? Your speech, your movement, your vision. It controls your memory. It controls all the things you do, things you think, things you remember, things you know. What it doesn't control, it does control your breathing, so that could be affected, but what it doesn't control is your heart beating. That's from your SA node, your pacemaking cells of your heart. But if you run out of oxygen because you're not breathing, those will be affected too. So people certainly do die from strokes, but more commonly than dying immediately from a stroke is having some deficit or some sort of problem from that stroke. So let's say it kills a part of your brain that you don't even use, or you don't know that you use, right? It's just a pathway for something perhaps. You may not even know that you've had a stroke. What if it controls muscle movement? Your brain is split into halves. It could control the muscles on one side of your body or the other. And so you may have paralysis or weakness on one side of the body. You could have drooping on one side of your face, but not the other, right? You could have deficit on one side. I can't lift my right arm, but I can lift my left, right? That's going to be unique. It could be a memory problem. It could be a vision problem. There's going to be all kinds of signs and symptoms. It is though from, sorry, there's just a list of risk factors. We know those: smoking, hypertension, age. But the signs and symptoms are going to be change in behavior, memory problems, paralysis on one side of the body, weakness or fatigue, vision or sensory deficits. What do we do for a stroke? Well, it's actually pretty simple. There's nothing we can do to fix what's going on in the brain. We won't even be able to tell right away whether it's a bleed or whether it's a block. So until they do that angio-CT scan of the brain, we're not going to know for sure. So how do we get that? You're not going to do that where you are. So we're going to call for help. They're either going to bring the helicopter, because it is important to get them to the hospital as quickly as possible, or a good EMS service is going to be there pretty quickly and start treatment on the way. And certainly get you to the hospital where they can figure it out as quickly as possible. So for a stroke, keep the patient comfortable. Obviously, airway, breathing, circulation. If they are unconscious for any reason, we start CPR. But pre-unconscious, we keep them comfortable, call for help, and just maintain that airway, breathing, circulation for them. Talk to them, comfort them. I'm sure it's a stressful time for them. They don't really necessarily know what's going on. It's just strange for them. They may be paralyzed on one side of their body and not the other. So just put them in a position that's comfortable and reassuring for them and be with them until EMS arrives.